medical misinformation.
There's a lot of talk about cortisol levels, and it's confusing. And patients are confused because they're watching different podcasts and things, and it's always leading towards some sort of sale. But I want to give you a little bit of a primer. Hey, everyone, this is Dr. Mitch Ghen. When it comes to cortisol release from the cortex of the adrenal gland, there are acute elevations, there are rhythmic, and there are chronic elevations. Now, we expect that because we need cortisol. It's our stress hormone. But when we are in the fight or flight position too long, then there is this chronic elevation that occurs, and it is often gives too much cortisol, leads to some difficulties. Now, that difficulties that we need to be aware of too much cortisol, increased suppressed immune system, the body becomes more susceptible to infections and illnesses, weight gain, because cortisol can increase your appetite, of course. You can get high blood pressure, you can get impaired cognitive function, and prolonged elevated cortisol levels may affect your memory, your concentration, and decision-making abilities as well. Sleep disturbance and high cortisol levels will interrupt the sleep-wake cycle, and mood disorders and feelings of anxiety, depression, and irritability will occur with too much cortisol release. And there's even digestive issues, which can include conditions such as irritable bowel syndrome and indigestion. Now, the muscles could waste from too much cortisol. You know that because if you give too much cortisone in general, you can have that problem. But you get weakness, you can have breakdown of the muscle tissue. It could be inhibited of the growth of that muscle. So if someone says they're lifting weights, they're getting nowhere, it's not always just testosterone. It could be cortisol as well. There are skin problems such as acne, eczema, and inflammatory skin conditions that occur when there's too much cortisol. And hormone imbalance is important. Cortisol can disrupt the balance of other hormones, especially when it's too much, including a lowered libido. Again, not necessarily a testosterone issue. So if you have someone with low libido, you may want to think of this as well. Here are 10 signs that there may have a high cortisol level. So first is chronic fatigue. Second would be weight gain, especially around the abdomen. Poor quality of sleep, high blood pressure, muscle weakness, and even pain, for example. Digestive issues, bloating and indigestion, and of course decreased libido and increased susceptibility to infections need to be thought of. Skin problems such as acne, of course, and rashes. Now, I know that many other things can fit into this category, and it may not be cortisol, but here's some hints that you should think about if someone does have too high cortisol, leading to the main point, which is first get out into nature. There's something about being amongst trees, animals, nature that calms us down and stops us thinking of tomorrow, which anxiety, which releases cortisol, does. Learn to meditate and live in the present instead of thinking about something else. Why not right now? It's perfect. You're in the trees, you're having a good day, etc. You can use things like boswellia, ashwagandha, vitamin C, and less caffeine. They're potentials for you as well. And for most important, stop and smell the roses. Really, stop and smell the roses. But on top of all this, the most important thing, if you're patient or you believe that there's an issue with cortisol, is to do what you should do. Measure it. Get a 4-time saliva study. Make sure you do it exactly the times that are suggested, which are typically in the morning to about 7 to 9 p.m., in the afternoon from 11 to 12, 4 to 5 p.m., and in midnight, 11 to midnight, because that's when cortisol releases typically in its pulsatile form. And make sure that you drool that. Do not spit, because if there's any blood, even a microscopic amount of blood, it could very potentially raise the numbers and give you something that's not accurate. But if you do it properly, you'll get a very accurate depiction of the free cortisol and whether or not you or your patient or family member, friend, whoever is having real issues with elevated cortisol. Remember, ongoing elevated levels of cortisol, ongoing constant release of these stress hormones will eventually end up with a total lack or a major lack of cortisol, and that patient may even require cortisol in the form of hydrocortisone, which is what our adrenal glands make when you're healthy. Hope this was helpful. If you have any other questions, you can always feel free to write me at drmitchghen.com. That's drmitchghen.com. Thank you so much for watching. We'll see you soon.